Good afternoon. I hope everybody had a great lunch and that you're ready to continue with the rest of the day. We are entering into the last half of our conference and we're gonna start the afternoon with our panel. We are going to be talking about sex therapy with religious patients, working with Jewish, Christian, and Muslim communities. This is the new book that's out, which is amazing. I'm gonna give you a few facts about the book because I had to get woken up out my sleep to find them. So I'm going to share it with you. Some amazing facts about the book in all seriousness. It was #1 on Amazon's bestsellers list on its release date. It was #5 on the psychology list on its release date. It was #5 in religious studies on its release date. It was on the charts twice for sexuality, #1 in paperback and #4 for Kindle. I think that's some amazing, amazing facts for it to be listed so high. And at one time I was looking at it and it was third on the religious list, third only to the Bible and the Quran. So that was amazing. That was really amazing. So with that, I'm gonna go ahead and introduce our amazing panelists. We have some wonderful folks who have traveled a long way to come and help us discuss the book and talk about the impacts that it could possibly have in the community. The first person I'm going to introduce is Dr. Sheva Marcus in the middle there. Dr. Marcus is a licensed clinical social worker in private practice from 1997 to 2022. She was the clinical director of Mays Women's Health Center, the largest independent sexual health center. Her professional work has been profiled in numerous publications. So that's Dr. Sheva Marcus, welcome. Then we have Dr. Mark Yarhouse. Dr. Mark Yarhouse is the Dr. Arthur P. and Mrs. Jean May Reich. Am I saying that correct? Reich. Chair in psychology at Wheaton College, where he runs the Sexual and Gender Identity Institute. He is currently the chair of the task force on LGBTQ issues for Division 37, which is Psychology of Religion and Spirituality of the American Psychological Association. He has published over 100 peer-reviewed journal articles and book chapters and has authored and co-authored several books. Welcome, Dr. Yarhouse. And we have Dr. Wafaa, I'm going to try to pronounce it. Eltantawy. I did it. Dr. Eltantawy is a licensed gynecologist with extensive clinical experience in sexual medicine and expertise in psychosexual and relationship therapy. She is bilingual in English and Arabic and provides culturally sensitive, confidential, and complete services in both languages. So welcome. Welcome all of our panelists, if you will. Thank you. So we have this wonderful book that has come out. And I'm just gonna ask a few questions and I'm gonna let you talk from your heart and from your clinical experience about the book and how you view it. So with this book, Sex Therapy with Religious Patients, working with the Jewish, Christian, and Muslim communities, what do you really think, how do you think this is gonna impact the work that you do with your clients? And anybody can take this question and then I'll hand the mic.
I think I haven't seen a book like it's inclusive for all religions we come across in our therapy room. And I felt that book is really good. I haven't read it all, but I scanned through it and I read the chapter about Islam. And the chapter about Islam is really well presented and I felt like it's factual, which is contradictory to other things you read about Islam or hear about Islam from outside, other in media or social media or other people, or even people presented to your therapy. So I feel like people or therapists who are going to read this book, really they will learn a lot about the 3 religions presented in this book. And I felt like even the way the book was laid out, it's really laid out in a way, it's very clear, and also it's with some examples to explain what's written and approach the author to this book. I feel it's a good book and it will help a lot of therapists to navigate through lives with relations. This morning, I received an email from a therapist, I think Muslim therapist in UK, and she said that she wanted me to supervise her because she had a white English supervisor who can grasp the issues of her clients because they are Muslim. And she tried many times and she couldn't really help her to help these Muslim clients because she has no idea what's happening. She didn't understand. And I wonder why she didn't try to understand more about Islam or more about Christianity or Judaism if she is really working with different backgrounds, supervisees in her practice.
So in 2005, I got a phone call from an Orthodox Jewish woman in Australia who wanted to see if she could figure out a way to see me. And I was not seeing people virtually at the time. And I asked her briefly what the issue was, and it wasn't such a complicated issue. It had to do with orgasm, and she did not need an Orthodox therapist for this, a Jewish Orthodox therapist. So I said to her, maybe you could find a sex therapist near you in Australia. And she said to me, and it really always stayed with me, she said, Sheva, I actually saw a sex therapist in Australia, and she made me feel so embarrassed and so much shame about the laws of Jewish ritual purity. And she made me feel like I was in this archaic world that I needed to be liberated from. And I just did not feel like I could see her. And I'm hoping that a book like this will actually get out into the hands of therapists all over the world who will realize two things. Either they can become more culturally sensitive, or maybe they will say, I can't necessarily handle this because it is too complex, culturally sensitive, and I'm gonna realize how important this, your religion and your faith is in your life, and they can send you to somebody who can be.
Early in my career, I was sitting in a session that was run by a group that was responsible for kind of teaching and psychology and education. And they had done this massive survey for a major mental health organization on all these different elements of diversity. It was really important. And as I was sitting there, I realized there was nothing on religion. And so I wrote the chair of the task force and just asked, and just been oversight, maybe they just didn't cover it in that symposium. And he said, not only did we not cover it in the symposium, we didn't add it to the questionnaire. We didn't survey people. We didn't think of it as an area of diversity. And I think a book like this reminds students, reminds faculty that religion, spirituality are areas of diversity. They're often overlooked in our field. Many people in our field do not necessarily identify as religious, and so they overlook these areas. So they don't think of it as a clinical competency. And this book sort of brings that to the foreground, pulls it forward, reminds us that religion is very salient in the lives of many, many people. So to assess for that, to have the clinical practice skills necessary to work with people in that space. All of that comes to the foreground, which I think will help many patients eventually, many students in clinic.
Thank you. Yes, that is, you're right, all of you. People don't seem to think about religion as a culture and how it impacts people's sexuality. And that is important. We talked about culture earlier today, and the culture is so important in how people approach their entire lives and their entire being, and especially with sexuality. So I appreciate that. Thank you so much. So this book is just out and it did well really quickly. Why do you think it did so well really quickly? Especially when we talk about not a lot of people are looking at religion as a way to approach the work, but why do you think it might have gone so well so quickly? Any ideas?
I mean, I think that there's a dearth of literature out there on religion, and I think that people who are spiritual and religious are hoping for something like this to come out.
I think too many clinicians realize it wasn't part of their training. And so whenever we kind of get done with our training, we look around the world around us and realize, okay, it's a little more complicated. The training taught me the essentials maybe of many things that I needed to know or what my field thought I needed to know, but it may overlook areas. And so you have a book that comes out and says there's a whole area that you might not have covered. I think people pick that up and they realize I'm responsible to develop those competencies. I mean, if I said to you, I'm not confident with an entire group based on demographic characteristic, you would say to me, you're responsible to develop those competencies. You can't just walk away from that and say, I'm not going to do that. So I think when a book comes out that shines that light in an area, you realize, okay, these are 3 major world religions that are covered. And I think they're not one, I'm as a Christian, the one on Christianity in particular, you know, Christianity is so expansive. It's so difficult to capture all the nuances. And I'm sure that's true for the other major world religions. But to at least pull it forward and say, this is something that's really important, and to capture many of the elements of it that would be important to you as a reader, to work with that population. I think those are things that would move it to good sales and good.
I think this book will really be very informative for many therapists. It's the way it's, as chapter go along, and how it was divided, and how it takes you through the information about each religion is very important. But there is something I think as a therapist, we always miss, is the difference between religion and culture, and how much they overlap, because they overlap enormously, and people don't understand that. There are certain things in religions, they are facts, and people follow them, and there are cultural misconception, a lot of cultural misconception out there, and people take it as is the truth. So I think it's important to understand the difference between culture and religion and how they impact each other. And I can see that the author here put a chapter about, or he talked about the conflict between culture and religion, which is very important. And it's important, you see, the thing really makes me wonder many times when I hear clients come to see me, because I'm a Muslim therapist, that the therapists they have been to, they really didn't understand anything about what they talk about, or about their religion and where they are coming from. And they felt like very ashamed, they felt belittled, they felt like unheard and unlistened to. And that's really difficult. Therefore, I found that most of the clients come and see me, they come because I understand Islam. I'm not a scholar, I have to admit, but at least I know enough about Islam to help my clients.
Thank you all so much. Now, we talked about all of the good things that came along with the book, but it wouldn't be balanced if we said, what kind of challenges do you see that may come up in working with this book and clients in your therapy? Are there any challenges that you may see, or any challenges that you may think of that people might push back with a book like this? Oh.
I think there is a lot of, I don't want to turn political here, but there is a lot of hostility towards Islam in the world. And I think people, therefore, they don't understand Islam well, and they don't try to find for themselves what Islam means and what really it teaches people. And therefore, I think a book like that, maybe people won't really appreciate if they don't have open-minded about what they should know about Islam and other religions. I'm not talking about Islam only, because there are people who don't know anything about Judaism and Christianity there. But because with what is happening in the world, it puts Islam in a very bad place. And therefore, I think this book would be challenging for someone because they don't want to know enough about it, or what they read, it won't suit them. But again, people who are open to learn, they will get a lot of benefits from this.
So I have to start by saying I'm a little humbled here, because a number of people in this audience are from the Orthodox Jewish community, and like every other community, there's many, many disagreements about things. So about this as well. And also, I only got the book 2 days ago, so Caleb, I saw it and couldn't do a deep dive, but one of the things that I noticed and was actually quite beautiful, but I think also raises some issues, is that Judaism in its It's in its purest sort of form in its, if you go back to its oldest origin, has a very positive attitude towards sexuality. But as we know, Judaism over the years has developed in generations and generations of books and laws and layers and layers and layers of both customs and mores. And many of those strains have been very different in terms of their positivity towards Judaism. Hasidism in general has had a very deep history in different attitudes towards sexuality. And to suggest that there's just one positive attitude towards sex is complicated, because you're looking both the de jure and the de facto, right? The de jure, Judaism may, I could give a beautiful rendition of how positive Judaism about sexuality. When you get into the trenches and you look at, again, the layers and layers of laws that have developed over the years, and the perspectives and the way sex has been looked at, it's much more complicated than that, and it isn't always so positive, and that also leaks into the community. So I think, if one is concerned with sort of the broader sense, it may be, I'm just wondering if looking at sort of Judaism from the most sort of cleanest, most beautiful, positive way, Caleb, which was like, it was touching as I read it, I think also can have, raise some questions with that.
Yeah, and I often read a book and I think, well, like my students or myself, well, I see myself in it. So you have chapters like on Christianity. It's so expansive, right? I mean, so would a Catholic Christian see themselves in the chapter? Would an Eastern Orthodox see themselves in the chapter? Would Protestant evangelicals see themselves, mainline see themselves? That's an impossible task for any author to ask that of a book, for a book to ask that of an author. But it does pull the conversation forward in a way that forces you as a reader to say, okay, there's enough here for me to realize I'm not doing my due diligence to this population. So what do I need to do? What are the steps I need to take for the couple in front of me? And I think that's what you would ask them to do. It would sort of prompt you to be responsible in that way. And that's what I want from students.
I alluded to this before, and I think this is really important. I think one of the things we all know is what we don't. What's important for us to know is what we don't know. And I think that really sort of opened a level. A therapist may say, like, I don't know this, and I can't become culturally competent in time, but at least I know what I don't know. And that's so.
I think that's the problem here, that some therapists, they don't know, and they don't know they don't know. And that's very frustrating, because you see, I come across clients, probably I don't know enough about them, or I don't know enough about their religion. I don't know enough about their culture. So I'm willing to learn. I ask them questions, I learn from them. And that's the beauty of being a therapist. It's not like you impose your beliefs and religion or whatever you have in your clients. Actually, you learn from them. And that's very interesting, because you see, I come across therapists who are not willing to learn. And they start, instead of listening and asking and trying to find out more, they start imposing their beliefs on the client. And that's not what we are there for. We are therapists. We are there to help our clients from their perspectives within the context of their culture, relationship, religion, and whatever they are coming from. What I like about this book also, when I read the chapter about Islam, it's a good thing about it, it's factual. In a way, like it's actually reflected the Islamic teaching, not only just written without any evidence, but actually there is a lot of verses of Quran there and from Hadith, which are the statements cited by our Prophet Muhammad. And also a lot of studies there which documents or enforce what's written there. So it's really good. I would encourage you, if you don't know enough about Islam, read this chapter, because I really felt touched by reading this chapter. Thank you.
Thank you all. Yeah, I do agree with you there. We have limitations with a lot of things because you can't possibly include every step that you can think of in one book, but that doesn't mean we can't write book number 2. That's what Dr. said. And at the same time, you're right, it forces people to go, well, this may not be applicable to what I believe, but how do I then take this and make it applicable? right? How do I look at it from the beliefs and values that I have in order to help people who come into my office? So that's what we want people to do, right? This is just the beginning. This isn't the end, right? This is the start. And so, hopefully with this book and encouraging people to read it, because again, you're right, they don't know what they don't know, right? But if you start to read, then you realize, well, I didn't know this, and then, oh, there are some things that maybe I can do, and maybe I can contribute to the field that will help people to be able to navigate folks with the same belief systems that I have. So thank you for that. Does anybody, I'm gonna pause for a second with the panel and give them a breath. Does anybody from the audience have a question? We'll take questions from the audience if you want. Any comments? Comments? It's gonna be a long day.
Yeah.
Give people a chance to think.
Okay, no worries.
There's, so early on in the book, there's this fascinating thing that, the author takes like different controversial topics in sexual health. And this is when I knew I was gonna like the book because, there's a topic that comes up so you might have a religious doctrine that bumps up against mainstream sexual health conclusions about that topic, whatever it might be. And so the mainstream says something about it and the religion says something different about it. And the author, instead of saying, well, we're gonna have to be careful about that faith background, the author says, you know what? You might have a bias against that religion. And so for you to draw that conclusion because of probably the training you've received, the educational background you've had, that's actually not the path forward for developing competencies in this area. It doesn't mean that you're saying that every doctrinal position religion takes is one that you would say you would endorse, but to not take it seriously as the client sits in front of you in your office and says, the teachings of the faith that I adhere to says this about that. And for you to realize I might have a blind spot there, I might have a bias, even when I look at mainstream sexual health and what they conclude about this same topic, I can't just say, well, because of that, you're wrong. I can't take a posture like that. It forces the reader to revisit the posture they're going to take towards people, to not adjudicate complex doctrinal issues, but to recognize they're a part of someone's life. How do you hold that with them? That's a critical and valuable piece of the book.
So it had to be like at least 15 years ago, there was this long form article in the New York Times about a therapist who was a evangelical Christian therapist who was working with gay clients at the time who had chosen to stay in the closet. And he was working with these clients to try to figure out how to navigate their life. It was a beautiful, beautiful article. And there was a lot of, both in the article they described it and afterwards, there was a lot of mail sort of attacking him because the thought was he wasn't helping his clients to live their authentic selves as their authentic selves. And I remember looking at it and thinking to myself, it's so interesting that we live in a world where people can't have competing values. Yes, it is definitely true that their sexuality is a super important part of who they are. We obviously all think that because we're in this room. But people have to also understand that community and faith are also fundamental pieces of people's lives, and to try to work on putting one ahead of the other without letting the client make those choices is really not beneficial to our clients. And I think the idea of the book allowing us to kind of just even shift the prism so that people can kind of understand that there may be competing values that are really important. As much as I think people's sexuality is the most important thing in their life, I also understand that for many people, religion and some other things may be equally important parts of their lives.
Yeah, I agree with you. And the thing really struck me here that this book touched in a very critical topics. Like I call them critical topics, and how they portray in different religions. So, for example, the author talked about premarital sex. He talks about masturbation. He talks about non-binary people and how religion portray these issues. And that's very important because it's still, even we are religious, we don't understand enough about these issues. And sometimes we can, that you see, as if he talked about transference today, I think even we don't spell it out what we feel about what we hear, sometimes the clients can get it. And that's very, very difficult if the client felt even we haven't said a word about what they are presenting, still they get it and they feel really bad and shameful and whatever. So I think there are different things which have been opened up in this book. Probably we need more, but it's enough as a beginning, or it's a very good beginning to start opening up all these sensitive issues in religion. And it's no harm. Sometimes we don't know, we can refer, or we are not sure, we can refer either the client to a rabbi, or we can refer them to a sheikh in our Islam, or refer them to a people who can tell us like enough about things we are not sure of. I remember a few years ago seeing Egyptian woman who was 45 years old and she hasn't been married. And we know that in Islam, premarital sex is not allowed, it's prohibited. And she doesn't want to commit any sin. So she came to ask me, what shall I do? I said, to be honest, I don't know, but I can see masturbation is not a big thing. And I had to contact a religious body in our country, it's Cairo, and they said, yes, in this condition, you can permit her to masturbate, to release, to fulfill her needs. So going back to religious figures is not a bad thing, and actually it helps us to help our clients. Thank you.
Yes.
So interesting. Fascinating topic, first of all. So over the years, I've had the occasion of working with very, Orthodox Jews mostly. And what I have discovered is, bottom line, they're human. Like there's a humanness aside from all that. And part of that is seeing people who struggle, very Orthodox people who have trouble with sex addiction, who have fetishes, who are unfaithful. Like I've seen all of these things. Maybe it is a bit of a different struggle because there's another layer of struggle within themselves, right? It's not even just moral, but there's the religious aspect. So, but bottom line, in my head, I'm like, you pray in the morning, you go see your prostitute, you pray at night. Like, how do you consolidate those two things, right? It's a lot about that, and just asking a lot of questions, getting them to question it, is part of that healing process that I found in treatment. And then I was thinking of a woman who was an Orthodox woman who had, I think at the time, 5 children, and realized that she's gay. And she didn't know what to do with this. And so we were doing the, okay, if I choose this path, what happens? If I choose that path, what happens? And she knew that if I choose to go and live my authentic self, my children are taken away from me, I lose my entire community, all of that. And so we worked on how can I keep that? How do I make the choice? It becomes a choice at that point, right? It's an authentic choice. So yes, I know what my sexuality is, but I'm making the choice to, yes, maybe repress, deny, whatever it is, because this matters more. And so it's, helping make that choice instead of going with, what I would normally say, you need to live your authentic self. Well, it's not on me to say what your authentic self is. So it really gets you to think. Working with religious clients gets you to think outside the box a lot as a therapist, for sure. And for me, it has been a very enriching experience working with all kinds of, all religions, a lot within, in every aspect, actually, with every religion, so.
So I believe a part of the purpose of publishing this book is to make people aware and help us understand the importance of religion. But I'm thinking we got to target the students. We got our education, and now it's harder to learn in a certain sense because we feel like, oh, we're this kind of therapist. So I'll refer out, but students, they have more of a flexible mind, they're possibly more open to learning because if they're in that environment. How can we, as an organization, possibly implement it that the students it should be part of their curriculum? And like that, it's gonna be different when they're gonna be as therapists.
Yeah.
Thank you for your comment. I totally agree that religion in sex therapy should be introduced. And not only religion, all aspects, culture and everything, whatever you study, it should be comprehensive. And I think we have also to introduce something to the medical schools or like universities about relationship and sex and religion. I think that's missing in all countries. I know I'm practicing in UK, but I know also about my country, Egypt, is still we haven't got any such thing at all. Because psychoeducation early on, or education early on about sexual medicine, about relationships, about sexual relationship, I think early on will help us again to probably listen the sexual dysfunction we come or sexual problems we come across, but also enlighten the future generation to learn more about that. Thank you.
Do one of the other panelists want to add anything to that?
I couldn't agree more with the idea of education and training in religion and spirituality as a competency. I think the question is going to be the level of exposure, right? You can have it covered in a multicultural diversity course, but it would be introductory at best, because there's so many things covered in a class like that. But you could have classes in psychology of religion or the applied psychology of religion and spirituality for clinical practice. Then there are some institutions that have like an emphasis, like a track, like concentration in it, not many. And then there are schools that their entire program is sort of oriented towards like a faith background. So like Divine Mercy University in DC, Northern Virginia is a Catholic siding program. Wheaton College, an evangelical PhD program. So there's different things like that. The challenge there is they may do a deep dive in their understanding of Christianity, but not in other world religions, which makes it, incumbent on us as we try to facilitate the competencies that we need to have, our students need to have, is to be more expansive than just the deep dive and what we're personally more familiar with. Though I always appreciate having colleagues that I can go to and say, I know you have advanced competencies in this area that I don't have, so to go reach out. Which an organization like this is terrific, creating avenues for those types of professional relationships.
So I just wanted to piggyback on what Mark said, because I think it's so important, is that we can't know everything. We can't learn everything, we can't know everything. And I think it's really good to have basic information about religion so that you walk in with some level of knowledge. But I want to take a slightly different tack. I think it's really important to have sex therapists in each of these communities, right? Like, there is no way that I will ever be able to see a Muslim patient the way Wafaa can. Like, I just feel like that is just not going to happen. And I think it is amazing, for example, the fact that you two of you are coming in from the Hasidic community, incredible to me. When I started in this field, I don't know, 40 years ago, there were 2 Orthodox Jewish sex therapists at the time. And now there are so many, and there are schools for Orthodox Jewish therapists, and they're also very diverse, because somebody from your community might not necessarily feel comfortable seeing somebody from the more modern Orthodox community, and vice versa. And as Mark was talking about, all the different Christian, sects, is that the word I would use? Branches, Christian branches. Knowing that there are good, competent sex therapists handling those communities makes me feel so much better.
Thank you. Any questions, Sheva?
So we're hearing that we can't be great at all of them. My question then becomes, how do we do it in a way so that we make sure that the client doesn't get pushed away or doesn't become discouraged and just says, you know what, nobody can help me, I'm just not gonna help myself, and I'm just gonna stay that way.
I think your question is really good. It's again, you see, therapy is not about being a doctor. Therapy is a different relationship, as you mentioned in your presentation in the morning. All our work lies within the context of therapeutic relationship. And there are some studies out there showed that 70% of our work really happen in the context of good therapeutic relationship. So if I manage to, with my client, to build a therapeutic relationship, which is good and open, and there is a lot of trust between us, and I think I can, if I feel stuck at any time or I feel I'm not a good therapist for them, is to say, actually, I can't deal with this part, but I can refer you to someone else. So this all again, and your client in this case feels like he was or she was handled well and contained and whole and held. And then you pass him to someone else because they trusted you and they trust what you say. It's not about getting rid of them or pushing them away. It's actually about, I know my limitation here. I helped you enough, but I know someone better than me who can help you. Thank you.
I think, and this is probably the most controversial thing anybody said this entire conference. I actually think this is where the internet and social media can actually be helpful. I feel like when people are searching for somebody who does speak in a way comfortably that they feel comfortable with, and they have a place to find them now, which they couldn't. And often people can see therapists from far away, right? So, if somebody is Jewish or Orthodox and looking for a sex therapist and is not comfortable with me because I don't cover my hair or because I wear pants or for any number of reasons or my language, they're going to keep looking for another therapist in that community that will make them feel more comfortable. So I feel like that's like one really good thing. And people can, because of being able to see people virtually, people can go lots of places and see people. I can see people in lots of different countries. And I feel like that's really been a game changer.
So one common way to think about competencies is through knowledge, skills, and attitudes. And so we've talked a lot about knowledge. I don't have enough knowledge. How can I ever have enough knowledge? You know these things. Well, that's just one element of competency. And it's good to know what you don't know. It's good to familiarize yourself with what you can. It's good to know people you can refer to. And that's all in the domain of knowledge. Skills. There are basic skills for working with religious people that are respectful of their faith tradition, incorporating it into your assessment, for example. Some things that you don't have to know everything about every world religion to be able to be sensitive to incorporate questions about religion into your assessment. Then you get into more maybe intermediate skills with incorporating it maybe into a mindfulness exercise or deep breathing and relaxation and things like that. Some of the passages of a sacred text that could be incorporated would be a little bit more advanced knowledge. But I think the other piece is attitudes, and that's something that is we're sort of lagging behind. But to have sort of a what you might call kind of a religion compatible attitude as a clinician is another piece of competency. Just like knowledge, just like skills, your attitude, your posture, your religious compatible understanding that you have a client in front of you who has an entire meaning-making structure where their life is tied to transcendent purposes that you may not fully understand, but you recognize it exists in the room for them. That's a good attitude that we can teach and model to our students how to carry that when we're sitting in assessment.
So this is a bigger challenge, and maybe it's something we can discuss, but one of the things, one thing I noticed is some religious people are coming to me, not because I was Jewish, because they thought I wasn't. So they don't want, I don't want to be in my community. I don't want to go out and see a therapist who lives in my community. So they, it's my last name is Petito. It sounds Italian. They figure I'm Italian. And when they start talking to me, they're teaching me with thinking I don't know, right? So then when I'm like, okay, does your wife go to mikvah? And they're like, how do you know that, So it's very interesting. So they come to me because they think I'm not part of their community. So how do we deal with that? And I agree, Sheva, with the, now with access online or whatever, you don't have to be in your community. It could be, I could be in Montreal and talking to somebody in New York and it's fine. It's not going to be known. So how do we how do we do this as as a greater social, like we need to do something, right, at some level as therapists to counter that in this realm. Well, once. This happened multiple times. This is not just a one client thing, right? When they realize, I think, if of course I would share that I am Jewish. And at first a little taken aback, and then I said, but it's okay, I understand, and we would talk through the discomfort, and then they would continue, like they actually were okay. And maybe because I'm not part of the religious community, and I'm unlike, I don't live in their neighborhood and what have you, but I always talk about confidentiality. I always talk about, if I see you on the street or at a Jewish event, I will never acknowledge you. It's not because I'm being rude, but so I do that whole thing, especially when I work within my community, because I've gone to, weddings and bar mitzvahs where I could scan a room and say, that's the foot fetish, and that's the this. I know everybody here. But of course, I just don't acknowledge in a friendly way unless they acknowledge me.
I think part of what we do is contracting. And that's a very important thing, to contract with your client. I'm glad you mentioned confidentiality, because this is a major thing. A lot of people come to you and they are so terrified about, them, particularly if they come from your community, them, the relatives, and you might come out and tell everyone what they are there for. And therefore they are worried about judgment, about shame, that if you are the same person like them, like Jewish or Muslim or whatever, and then you will judge them.
And running into others in the waiting room.
Exactly.
So
Not only that,
yes,
running out to people in the street or in events. I'll give you an example. I work in London, and we have many Egyptians in London. I know a lot of doctors in Egypt because I'm involved in many things. I know them, particularly people from andrology and urology, because I work closely with them. And I have people from London who are doctors who wanted to be seen by me, but their main issue, a lot of doctors in London and in Egypt, so you will tell them. I said, I can't tell them anything. You see, we work differently. We are not doctors. Even I met you outside, I'm not going to acknowledge you. Right. So all of that comes in your contracting, because in contracting, you might go as far as if I come across you in the supermarket or in a shopping mall, what shall we do? So up to that, to say, shall I acknowledge you? Shall I address you? Or we can ignore each other. So it's about building that contract and putting everything in your contract. And as you go along in therapy, you build your trust with patients, and they build their trust with you, and then they feel safe.
I also include their rabbis. So I will tell them, please ask, this is, for example, they'll say, if I see a man, could you leave the door open? Because they're not supposed to be in a closed room with another woman, which I totally understand. And I've spoken to other clients, have spoken to rabbis. I said, ask them if it's okay if we keep the window open. So I make sure I have the window open, and I let them know this. I said, other clients have spoken to their rabbis, and this is what they have said. And it's, if you're with a doctor, even if she's female, it's okay. Like, they've given the okay. So those kinds of things. And then I tell them as well, I have a waiting room with a door that closes. And I will never schedule, this is when things were more in person, I will never schedule two people from the same community back to back, never. They'll always be a few hours apart. So you will never run in front, you'll never see them outside, and you will never see them in the waiting room, or won't cross them. So these are the things I put in place because I am sensitive to that. And I think that's what the book does, is it sensitizes us on these issues that maybe we wouldn't have thought about. And these are things we have to think about. And it's only just by having these clients who taught me these things that I've become more sensitive. So yeah, we don't know until we know. And then now we can put into practice. So It would be great if this was part of a curriculum. I wish I had been taught this early on in my career.
Correct me if I'm wrong, but it seems like each of you have only really been able to take a deeper dive into the chapters of your practicing religions respectively. And were you able to skim the other chapters? If you were, I actually think that's of great value because a lot of people don't read a book cover to cover. They kind of will just skim. If that is the case, did you find information about other religions which surprised you that you wish you had known earlier? Or would you say that this book is a little bit more geared towards the elementary therapist, somebody who hasn't been practicing for a long time or hasn't been exposed to people of various backgrounds as a seasoned professional?
It doesn't mean that I read this chapter about Islam. I'm not reading the other. Actually, I dipped into other chapters. And also I see Christian clients. I worked for a number of years in a clinic because I'm a medical doctor as well. So I do sexual and reproductive health. And part of what I'm doing contraceptive advice and fitting intrauterine devices and coils. So I do all of that. So I understand a lot about people from the medical side. When I see them, I understand a lot of them about culture. I have to say that being a therapist, as being a doctor, both of them are like come together and they help me in whatever side I do. So there was a time where I ran a clinic for 5 years in an area in London called Finchley, and Finchley is full of Jewish women, Jewish people, I mean. So I used to see a lot of Jewish women in my clinic fitting them with intrauterine devices and I learned a lot from them about that they can't have sex until they go to that place and have a ritual bath and all of that. So when I check their coils, I can't touch their cervix, the neck of the womb, because if I touch it, it's gonna bleed, they can't have sex, they have to go back and wash again. So I learned a lot, and I'm not seeing only Muslim, by the way, because I run the psychosexual clinic in my trust. So I see people from all religions and from different backgrounds, from different culture. So I'm dealing with all of that. I know a lot about Christianity because I see Christian clients either in the clinic, in the context of medical work, or in the psychosexual clinic. So we are here today. It comes across like we represent our religion, but it doesn't mean only that.
Yeah, I think what I meant to ask
Is that as a seasoned professional who has seen patients of a variety of backgrounds, and you kind of speak to that, would you say that there are things that you have learned from this book? Or would you say that this book is more appropriate for somebody, just entering the field, or somebody who hasn't really been exposed to people of a variety of backgrounds? Did you find anything surprising or interesting that you didn't know from this book?
I won't be able to answer you fully because, as I said, I know enough about my clients.
Yeah.
But when I read it, probably I might find definitely no information.
Yeah.
So I can't comment right now.
So it is interesting because they're all, these three major world religions are the religions, of the book. Sometimes call it Abrahamic faith religions. So they share a lot in common. So I think I was reminded of that reading the other chapters, like, wow, there's a lot that we actually base a lot on that precedes maybe how I think of things in a contemporary context, but like, where are the origins of all of these world religions? Share some very strong overlap in teachings around sexuality and gender. So that was a good reminder. There's some other elements in Islam and Judaism, different, well, I said branches for Christianity, so let me be respectful. Branches of Judaism that, like, I was kind of vaguely aware of, and I think there's a lot more I need to understand, but it was like, okay, that's a good reminder. These are different experiences of Judaism within that world religion. Extra written materials, both in Islam and Judaism. You have that more with Catholicism than with Protestantism, not that there aren't other like writers who things, but they're not held with the same reverence as you do other sources beyond the sacred texts, or maybe they are now sacred texts. So before I demonstrate all of what I don't know, I'll just say that those were pieces that were, that's a really good reminder, because the author does quote a number of sacred passages
Yeah.
in each of the world religions, which I thought was terrific.
So I think is the most interesting for me, and I haven't done a deep dive, I'm just, I got the book very late, so what I was gonna say, the content versus the context.
Mm.
So the language, I think, that's used, like you will talk about faith. With religious Jews, I will talk about religion, I'll turn observance, I will never use the word faith. And the minute I use the word faith, they would know that I was not part of the community. So I think what I'm really excited about looking more for in the book is the language that I think is really, really interesting. And I do think as a clinician, you get into a niche. Like I have seen Muslim clients and I have seen Christian clients, but far and away, I either have secular clients or Jewish religious clients. Like that's where my niche has fallen into. So there's no way that I could possibly understand these other religions. Really.
Yeah, and I think all religions share something. Or they have similarity. For example, in Islam, we can't have sex straight during our menstrual bleeding, and we have to wash after. You can't resume sex without having a proper bath or a proper shower. Exactly like in Judaism, they can't have sex without having really purified again or having a wash. But it's different. We have shower at home, they have shower at certain place. So you will find similarities like that in all religions about you, not necessarily in this area, but you will find there are similar things happening. And I think, yeah, probably Christianity and Islam, they are like sharing a lot of teaching there.
Thank you all. Any questions?
Sorry, I was waiting to. So for the meantime, until we do become more familiar with the religions from other backgrounds, from other communities, it seems to me like it's important to respect everyone. In the meantime, until we get education, the foundation is respect for everyone, and that is really like a building block.
I think also you can learn from your clients. So ask them, if you don't know, say, I don't know enough about that. Can you tell me more? Or can you give me some readings or whatever? I think that's important because when you show interest in your clients and interest in what they bring to you, actually they trust you more and they will be willing to teach you.
I have to share just a funny story. One of the nurse practitioners who worked for me in the sexual health clinic was an Irish Catholic, and we had a lot of Orthodox people who came. Staining, so just the specific rituals that are associated with sex in Orthodox Judaism is, I'm telling you, by far and away the most complicated. It's not, from the time that a woman sees blood, she has to count 7 days, a minimum of 7 days. She's got to do internal exams for 5 days to make sure that they're coming out white. Then she goes to this ritual bath. The ritual bath is a very, very complicated construction. It's the most important thing that a community has to build, more important than building a synagogue when they move into a community. It is extremely complicated. And when you see a speck of blood, you then have to separate from your spouse for 12 days again, in many cases. And so you can see that could be very problematic. And so the rabbis have worked, the pages, the volumes and volumes and volumes that have been written about Jewish law, about menstrual cycles, you can't even begin to imagine. And what the size of the stain has to be, where you see the stain, how the woman finds the stain, who approves that, whether that stain makes you in nida or not in nida, which is, able to touch your spouse or not touch your spouse. And this Irish Catholic nurse practitioner of mine, we had a woman there and she was talking about putting an IUD and she was nervous because sometimes you stain when you get an IUD. And the Irish Catholic nurse practitioner said, well, couldn't you wear dark underwear? Now, to know that if you have a stain on dark underwear and then you take it to a rabbinic authority to see whether or not that makes you pure or impure, is such an esoteric concept. But she had been working with Orthodox women. I've been working with her with Orthodox women for 5 years. And it was a perfectly normal question for her to ask. And I just think that's, when we talk about developing cultural competence, it's possible, but it's very much, I think it reminds me a little bit about, Latanya, what you were saying about learning sign language. I don't remember the expression you said when somebody asked you about it. You said it's like a beat and a half, a minute and a half. What did you say? Like, yeah, like you can't just, you're not gonna just learn sign language. You need to, but you can do it. Like you can become culturally competent. It just takes some work and effort.
I think the use of language is the most important thing in therapy. Not only in religion or culture, it's just to follow the language and the vocabulary your client uses. I think that's very important. Yeah.
So I would love for this to be incorporated in programs across universities and colleges. This is just as important as any other therapeutic class that you take, right? Because everyone comes into the office with some type of belief system, and it 8 times out of 10 is going to be one of the Abrahamic faiths, right? And so we need to know that when we ask questions, we need to incorporate those questions, these types of questions, what their beliefs are, what does it say in your faith about A, B, and C that they're coming in with, to better understand how and if we are the correct practitioner to help that particular person. And if we believe that we are, and they believe that we are, that we make sure we do our due diligence in understanding what it is that we need to know in order to help them according to their faith and beliefs. Thank you all for that. This was a wonderful conversation. Really appreciate you taking the time to do that. I wanted to point out a couple things in the book too, which I think are really important. I love when you get your copy, because you're all gonna get a copy, right? How in the beginning of the book, in the beginning of the chapters, I should say, you have an overview of the chapter and then learning objectives, which I think is really, really keen. And then you also have throughout the chapters vignettes, right, that you can read through and see and talk about. There's also therapist bias check. You don't have bias, right? So read it anyway. Therapist bias checks, seriously, to help us look at what may come up for us while we're reading, right? Or what may come up for us when we're seeing patients. There's also a really nice reference pages in each of the chapters, not just the book. So that's really nice to have too. So just some important things that I thought were some things that was important that I thought I would point out. Before we close, do you have any of the panelists have any closing remarks that they'd like to make? No pressure. No? Okay. Any questions? Sure, absolutely.
I want to say thank you so much for bringing it to our awareness and for making it a part of us. I feel it's extremely important, and I look forward to reading it and incorporating it. And possibly even because I teach at Wurzweiler, I do anticipate to talk with the dean, and maybe we could do something about it.
Well, I want to say again, thank you to our esteemed panelists for your insight and your words of wisdom, for your perspectives. Thank you so much for taking the time out to be here and being willing to be on the panel and have this discussion with everyone. Thank you so much. I appreciate it. And thank you to all of you.